are doing a moderate whole body hyperthermia treatment with our patients in the so-called Heckel bed. Dr. Heckel was one of the pioneers in Germany who developed this whole body hyperthermia device some 40-50 years ago. And the aim of this therapy is to raise the body temperature of the patient to the level of at least 39.5 up to 40.5 centigrades. What's that in Fahrenheit? That's 105, I believe. Anyway, in centigrade, the limit is 40.5, as long as we are in the field of moderate fever, whole body hypothermia. And as you see, the patient gets, parallel to the hypothermia therapy, an infusion and with a natural biological anti-cancer drug. We're working with artesunate, which is a substance that comes from Chinese wormwood, Artemisia annua, that has quite amazing anti-cancer abilities. We increase the effect of the biological anti-cancer drug with hypothermia that makes the blood flow more intensive and enhances the uptake of the substance into tumorous tissues. This is classical combination therapy with warmth, hypothermia, and biological anti-cancer drugs simultaneously given. And the tolerance is very well. We never saw side effects of artesunate infusions, and the tolerance of fever range, whole body hyperthermia is very good.
It's okay. It's okay.
And of course, for the patients, it's a very special treatment. It's been challenging. It causes some feelings of high heartbeat and some stress in the beginning of the treatment. It's like jogging through the park or through the woods. The heart rate is right now is 86 per minute, which is still very calm, and we just began. The treatment started some 30 minutes ago, and in an hour the patient's heart rate will be at around 120 up to 130 beats per minute, and the patient will be in a totally different consciousness and feeling that reminds of fever that most patients never had as an adult, and it reminds of childhood fever. And this natural reaction of the body to develop fever is very, very healthy. It causes a lot of immunological reactions that trigger white blood cells to look for cancer cells and to be more active in the way of recognizing and destroying cancer cells. So we have a large variety of effects that we get from hypothermia. We have the enhancing effect of simultaneously given drug therapy, and we have immunological effects. And then we have a third type of effect that is on the level of emotional and mental issues, and maybe we can talk a little later about that. How do you feel?
Very warm.
Very warm.
Right in the beginning, but it's okay. But
it's okay. It's your, how many times have you?
The third time.
It's your third time.
First time was horrible.
First time was horrible. Yeah. But what happened after this horrible experience?
The horrible point was 38.3, and I had really mental problems. wanted to get out of this because I thought that I would never reach 39.5 degrees. And afterwards, it was okay, but definitely there's a point at 38.3 when it's really, really hard.
Yeah.
Afterwards, it's okay.
Yeah.
It's okay, and you're very proud of yourself. But
how did you feel afterwards?
Directly afterwards or the day after?
The day after.
It was okay. I was a little bit. I had the impression I had a little bit of fever, and I was a little bit tired. But it was okay. I didn't feel sick.
Yeah.
Not as 2 years ago after the chemo.
Yeah. And how was the second treatment?
Better, much
more easy.
More easy, not physically. Physically, it was the same. But yeah, my mind was very. Yeah, I was calmer than the first time because I knew that after this down 38.3, I would definitely succeed in.
Yeah.